Lyme disease. Lyme disease is brought about by four principal types of microorganisms. Borrelia burgdorferi and Borrelia mayoni cause Lyme disease in the United States, while Borrelia opsali and Borrelia guerini are the main sources in Europe and Asia. The most well-known tick-borne sickness in these areas, Lyme disease, is sent by the chomp of a tainted dark-legged tick, usually known as a deer tick. You're bound to get Lyme disease on the off chance that you live or invest energy in lush and vigorously lush regions where ticks conveying Lyme disease flourish. It's critical to avoid potential risk in tick-invaded regions. Side effects. The signs and side effects of Lyme disease shift. They ordinarily show up in stages, yet the stages can cover. Early signs and side effects. A little, red knock, like the knock of a mosquito nibble, regularly shows up at the site of a tick chomp or tick evacuation and resolves over a couple of days. This typical event doesn't demonstrate Lyme disease. Be that as it may, these signs and manifestations can happen inside a month after you've been contaminated. Rash. From 3 to 30 days after a tainted tick nibble, an extending red region may give the idea that occasionally clears in the middle, framing a bull's eye design. The rash, erythema migrans, extends gradually over days and can spread to 12 inches, 30 centimeters, across. It's normally not bothersome or excruciating, yet may feel warm to the touch. Erythema migrans is one of the signs of Lyme disease, albeit not every person with Lyme disease fosters the rash. A few group foster this rash at more than one put on their bodies. Different side effects. Fever, chills, exhaustion, body hurts, migraine, neck firmness and swollen lymph hubs can go with the rash. Later signs and side effects. In the event that untreated, new signs and side effects of Lyme contamination may show up before very long to months. These include erythema migrans. The rash may show up on different spaces of your body. Joint torment. Episodes of extreme joint torment and growing are particularly prone to influence your knees, however the agony can move starting with one joint then onto the next. Neurological issues. Weeks, months or even a very long time after contamination, you may foster irritation of the films encompassing your mind, meningitis, brief loss of motion of one side of your face, Bell's paralysis, deadness or shortcoming in your appendages, and debilitated muscle development. More uncommon signs and manifestations. A little while after disease, a few group create heart issues, like a sporadic heartbeat, eye aggravation, liver aggravation, hepatitis, extreme weariness, when to see a specialist, on the off chance that you've been chomped by a tick and have side effects. Just a minority of tick nibbles prompts Lyme disease. The more drawn out the tick stays connected to your skin, the more noteworthy your danger of getting the disease. Lyme contamination is far-fetched if the tick is connected for under 36 to 48 hours. In the event that you think you've been nibbled and have signs and indications of Lyme disease, especially on the off chance that you live in a space where Lyme disease is normal, contact your PCP. Treatment for Lyme disease is more compelling whenever started early. See your PCP regardless of whether indications vanish. Visit your PCP regardless of whether signs and indications vanish. The shortfall of manifestations doesn't mean the disease is no more. Untreated, Lyme disease can spread to different pieces of your body for a while to years after contamination, causing joint inflammation and sensory system issues. Ticks can likewise communicate different ailments, for example, babesiosis and Colorado tick fever. Causes. In the United States, Lyme disease is brought about by the microorganisms Borrelia burgdorferi and Borrelia mayoni, conveyed principally by dark-legged or deer ticks. Youthful earthy-colored ticks frequently are no greater than a poppy seed, which can make them almost difficult to spot. To contract Lyme disease, a contaminated deer tick should tear into you. The microorganisms enter your skin through the nibble and in the long run advance into your circulatory system. By and large, to send Lyme disease, a deer tick should be connected for a day and a half, 48 hours. In the event that you track down a joint tick that looks swollen, it might have taken care of adequately long to communicate microbes. Eliminating the tick straight away may forestall contamination. Hazard factors. Where you reside or excursion can influence your odds of getting Lyme disease. So can your calling and the open-air exercises you appreciate. The most widely recognized danger factors for Lyme disease include Investing energy in lush or green regions. In the United States, deer ticks are discovered for the most part in the vigorously lush spaces of the Northeast and Midwest. Youngsters who invest a ton of energy outside in these locales are particularly in danger. Grown-ups with outside positions additionally are at expanded danger. Having uncovered skin. Ticks connect effectively to uncovered tissue. In case you're in a space where ticks are normal, ensure yourself and your kids by wearing long sleeves and long jeans. Try not to permit your pets to meander in tall weeds and grasses. Not eliminating ticks quickly or appropriately. Microscopic organisms from a tick chomp can enter your circulation system if the tick stays connected to your skin for a day and a half, 48 hours or more. In the event that you eliminate a tick inside 2 days, your danger of getting Lyme disease is low. Inconveniences. Untreated Lyme disease can cause constant joint aggravation, Lyme joint pain, especially of the knee. Neurological side effects, like facial paralysis and neuropathy. Intellectual deformities, like debilitated memory. Heart musicality anomalies. Avoidance. The most ideal approach to forestall Lyme disease is to keep away from regions where deer ticks live, particularly lush, rugged regions with long grass. You can diminish your danger of getting Lyme disease for certain straightforward safety measures. Conceal. When in lush or green regions, wear shoes, long jeans got into your socks, a long-sleeved shirt, a cap and gloves. Attempt to adhere to trails and try not to stroll through low brambles and long grass. Keep your canine on a rope. Use bug anti-agents. Apply creepy crawly repellent with a 20% or higher convergence of DEET to your skin. Guardians ought to apply repellent to their kids, staying away from their hands, eyes and mouth. Remember that substance anti-agents can be harmful, so follow headings cautiously. Apply items with permethrin to dress or purchase pre-treated garments. Put forth a valiant effort to tick verification your yard. Clear brush and leaves where ticks reside. Cut your grass consistently. Stack wood perfectly in dry, bright regions to debilitate rodents that convey ticks. Check your dressing, yourself, your youngsters and your pets for ticks. Be particularly watchful in the wake of investing energy in lush or verdant regions. Deer ticks are frequently no greater than the top of a pin, so you probably won't find them except if you search cautiously. It's useful to shower when you come inside. Ticks regularly stay on your skin for quite a long time prior to connecting themselves. Showering and utilizing a washcloth may eliminate unattached ticks. Try not to accept that you're safe. You can get Lyme disease more than once. Eliminate a tick as quickly as time permits with tweezers. Delicately handle the tick close to its head or mouth. Try not to press or smash the tick, however pull cautiously and consistently. Whenever you've taken out the whole tick, discard it by placing it in liquor or flushing it down the latrine, and apply disinfectant to the chomp region.